You never think it's gonna happen to you, but I have cancer. The first symptoms was getting really constipated, and that wasn't normal for me. I started getting really painful cramps. They kind of felt like contractions. I was taking a bath, and that's when I felt a little bump inside my lower belly, and that's when it started to worry me. That's when I made my first appointment, and they told me it was an ovarian cyst.
When she presented, she already had quite large masses that basically filled more than half of her belly space, and were starting to spread to spaces like the surface of the liver.
That's when they started getting worried because it was growing really big. I literally looked like I was pregnant. It turned out to be stage 3 ovarian cancer.
Unfortunately, with ovarian cancer, we very rarely catch that at an early stage. And the reason why is because the presenting symptoms are so subtle. Bloating, which women often chalk up to other things, can be some changes in appetite, like you get full really quickly or just a loss of appetite, belly pain or pressure, or changes in bowel or bladder habits. And so usually what we tell people when we're trying to raise awareness of this disease process is that if you're having any of those symptoms for 2 weeks, that those are really sticking around, then it's time to see your gynecologist or your primary care doctor and ask for a pelvic ultrasound, ask for a workup and a rule out of ovarian cancer.
I first came here with Dr. Alldredge. She's the one that explained to me, okay, we're gonna do a biopsy. After that, we're gonna do surgery and then treatment.
Typically, it's a combination of surgery and we follow that with chemotherapy, and it's the kind of chemotherapy that causes hair loss and knocks down our blood counts and all of those things, but she's really done beautifully throughout that course.
The treatments, at the beginning, they were a little hard because I didn't know what to expect. But they didn't turn out to be that bad.
Because she's so young, I had a pretty high suspicion that she had an inherited cancer mutation. It is standard of care for us to check everyone regardless of age for that mutation, because now we do have this new pill that we give to people who have a mutation that really changes their recurrence risk. It's a pill that we use after chemo's done. It's called a PARP inhibitor to help keep cancer away. There is also use of PARP inhibitors in things like pancreatic cancer and breast cancer. It's not applied universally to all cancers. In about a quarter of our population, ovarian cancer develops because of a hereditary or inherited mutation. Oftentimes, ovarian cancer is completely sporadic and does not have any predisposing risk factors. Women who have birth control pill use for a prolonged period of time, who've had multiple pregnancies, those are women who have some protection because they're not ovulating as much. And so there's something to be said for less ovulation means less cancer risk. We don't often talk about ovarian cancer symptoms and what women should be looking out for, and so we actually call that the teal talk. We try to increase women's communication about that. So friends, family members are saying, hey, do you know about these symptoms of ovarian cancer? If you have them, you should be tested.
Don't ignore the symptoms you get, even if you think it's just something normal or something. Even if it's like a little cramping, don't ignore it. Just go to the hospital or make an appointment, get checked, because you never know.